with some caution. And look down and make sure that safety belt's buckled up for you. Back to you.
All right, Officer Fisher, thank you. And, of course, Monday means Ask the Vet. Dr. Joel Conn from Pismo Beach Veterinary Clinic is joining us this morning. We're going to get you an awesome stinger.
Great.
Soon, very soon. It's coming. And we are talking about something that many people may not be really aware of, but if you've watched Marley and Me,
right.
It's
so,
the illness that the dog suffered
It is.
there.
It's an illness called, there's a couple names for it. Gastric torsion is one of them, and the other name is gastric dilatation involvulus. We call that GDV because it's a lot easier to say.
Yeah, right.
But essentially what this is it's when the stomach becomes bloated and distended with either gas or fluid or food and twists.
Okay.
Oh, okay.
Okay. And so if you've seen Marley and Me, that's what happened. They came home to find Marley unable to stand, painful in his belly, panting, took him into the vet, and this is where vets get very upset. They said, there's nothing we can do. Okay. Well, so that's what I wanted to talk about today. There's lots we can do to help prevent it.
Okay.
So gastric torsion essentially is this bloating and twisting of the stomach. And it's actually very, very common. It occurs in big dogs, so dogs over 90 pounds, and certain breeds that have very deep chests, and those would include things like standard poodles, Great Danes, Rottweilers, some of these kind of giant breeds. And it occurs in about 20% of these breeds. So 1 in 5 dogs over 90 pounds at some point in their life is going to have this happen.
Wow.
Which is really, really common.
Yeah.
So that's kind of scary, and I think it's something that every large dog owner should be aware of. The symptoms are things like sudden, non-productive vomiting. So the dog's retching, nothing's coming up, or sometimes something is coming up, but vomiting is a major symptom. Extreme and severe lethargy, unable to stand, really depressed looking, panting usually, and then oftentimes is accompanied by a hard, distended belly.
Okay.
Okay, so those are kind of the most common symptoms. But basically, if you see any of these symptoms to any degree, we recommend that you seek veterinary care. And the problem is this seems to be a condition that always happens at night, when places are closed. Because I think people get home from work and they find their dog in this condition. Don't wait till the morning.
Okay.
What they don't tell you in Marley and Me is that it actually is quite treatable.
Oh.
About 80% of these guys, if we can get them immediately to a veterinarian and immediately to surgery, will survive this condition.
Okay.
But you have a time window, and so you do want to act quickly. We can diagnose it very easily with x-rays and blood work. So this is one that's very close to my heart. This is Bree. She's a 10-year-old female spayed standard poodle. She hangs out with us at the clinic. She's owned by one of my technicians, actually, who unfortunately lives quite far away from our clinic. She lives up near Paso Robles, and so she's about a 45-minute commute. She calls me at midnight. And Bree was having these symptoms. She was painful. She had a distended belly. This is a very skinny dog, so it's easy to see a distended belly on her. And she's not actually a big dog. She's only about 45 pounds.
Oh.
But this is one of the breeds we see it in. And Julie called. We told her to come straight down and took some x-rays. And I think we have a shot of that. So you can see this almost looks like a boxing glove coming at you, that black structure there. So on x-rays, gas is black. And that's all stomach.
Wow.
And if you haven't looked at a lot of x-rays of dogs, that doesn't necessarily mean that much to you, but that is a huge stomach. That's probably about 8 times or 10 times larger than it should be.
Oh, wow.
And we can actually see that it's twisted there. So we took her immediately to surgery. You actually literally untwist the stomach and do what's called a gastropexy, where you suture the stomach to the side of the body wall. And what that does is it prevents it from twisting again. So the reason I bring this up is so this is the way we don't like to do it on an emergency basis. When they're already sick, we have no choice. What we like to do is in dogs that we know are going to be giant breed dogs, when they're spayed or neutered, when they're young, get them in and actually do this prophylactically. So we do what's called a gastropexy at the time of spay or neuter, where we actually make a tiny incision in the stomach, a tiny incision in the side of the body, and this is, of course, inside, and we suture those two things together. And that keeps the stomach and the body wall together so it can't twist. They can still bloat, but they can't twist. And I think it's something we're recommending more and more and more because we know it can really, really help. And there's been some studies done that the dogs that have this done, really their risk for having a torsion drops almost to zero.
Okay.
Wow.
So kind of an interesting condition, one that we don't hear a lot about.
Right.
But one, if you've seen that movie, we just think, oh, they could have done something to help that dog and prevent it from happening again. You know, which if you don't treat it is a fatal condition.
Yes.
Is it something that the dog does to cause this?
Well,
or?
we think there are risk factors.
Okay.
So, you know, one of the things that you can do to avoid it if you have an at-risk dog is feed with an elevated food bowl. So that the idea there is they're not gulping down a bunch of air as they're eating. So you actually want a food bowl that's actually at their shoulder level. So for a big dog, that could mean a very elevated food bowl, not just the ones that are 6 inches off.
They would never knock that over.
Right, that means my dog eating at the kitchen table along with us, I think.
Right, exactly. So if it's a Great Dane, it may mean a bowl at the table. So that's one way to do it. That's an easy way to do it. The other thing is to avoid exercise immediately after they eat. So kind of like you always grew up saying you can't swim after an hour after you eat. It's the same thing with these big dogs. We want to avoid them running around and playing and gulping air right after they've eaten food. So those are a couple of things. The truth is we don't fully understand why it happens to some dogs. We think it's more just how they're built and their size that ties into it.
And now when you're talking about that surgery and doing it when they're spayed or neutered when they're young, is it something that you can do for a dog who is older, who may be at risk?
Yeah, and I talk to all my, if I have a new client come in with a giant breed dog, I do talk about it usually right off the bat. It's an elective procedure. But it's obviously better to do while they're healthy and you're planning it than on an emergency basis. And it's really, it's about a half-hour surgery. It's the same recovery time as a spay or a neuter, so it's very minimal. It doesn't add to the amount of pain or to the amount of recovery than if they just have those surgeries alone. And it's becoming very routine, depending on how many you've performed and that kind of thing. We do it a lot.
Very good. Well, it's always good information. I always learn something new when you come in. Again, if you have questions for Dr. Conn, you can email them, askthevet@kcoy.com. And thank you, as always,
You're very
for
welcome.
coming in.
Thanks for having me.
Very informative. And we'll be right back